Hello and welcome to the July 27th Virginia Opioid Abatement Authority Abatement Academy. My name is Jennifer Nelson, Virginia Institute of Government Assistant Director for Membership and Engagement. The Virginia Institute of Government is the leadership development and community engagement arm of the Weldon Cooper Center for Public Service at the University of Virginia. Through our research, leadership development programs, and local government engagement initiatives, we continue to work towards our vision of good governance, equity, and resilience in every Virginia community. VIG offers leadership development through SEI and LEAD, local government equity clinics, certification for treasurers and commissioners of the revenue, and customized training programs. State agencies and local governments can access a range of consultation and support services to build more resilient organizations. We have a team of seasoned public sector leaders and subject matter experts ready and available to facilitate boards of supervisors, city and town councils, leadership teams, strategic planning retreats, and other related events. Today, VIG is glad to partner with the Opioid Abatement Authority for the Abatement Academy series, presented every second and fourth Thursday through 2023. Here are a few housekeeping notes. This session will be recorded and posted on Weldon Cooper Center for Public Services YouTube channel soon. I'll also send out an email after the session to all registrants with the video link and other resources. If you have any questions, please type them in the chat and I will ask them for you. Thanks again for taking the time to join us today for this Abatement Academy session. Now I'm happy to turn things over to Tony McDowell, the authority's executive director. Tony?
Thank you, Jennifer, and good morning, everyone. Welcome to the Abatement Academy. I'm going to introduce our two speakers for this morning. Tom Jackson's day job as a registered peer specialist at Virginia's Western State Hospital and his night job as an organizer with the Virginia Recovery Advocacy Project work together to support and advocate for people with co-occurring mental health and substance use conditions. His more than 50 years of advocacy, his personal recovery since 1991, and his 20 years in public mental health and training in relational organizing engage and call others to action to fix our broken treatment system. He finds hope in the dedication and recovery of the clients he works with, in his personal recovery work, in the new PRS Hope Brokers program that he trains on, and in motivating and supporting others to end the war on drugs and make recovery the epidemic. Tom is joined by Robyn Hantelman. Robyn's a registered peer recovery specialist and a PRS trainer. As a steadfast advocate for multiple pathways to recovery, harm reduction, whole family recovery, and resilience, bridging gaps between clinical and peer support, and removing barriers to medication-assisted recovery, Robyn spends her days as a recovery coordinator at the Goochland Powhatan Community Services, which includes rural opioid overdose response coordination with the Root Project. Her evenings, in addition to being a wife to Peter and a mom to Sawyer, consist of serving as the co-chair of the Virginia Year of the Peer 2023 initiative, organizing through the Virginia Recovery Advocacy Project, attending every Foo Fighters show possible, and wrapping up writing her first book, which was co-authored by her son Sawyer and showcases his perspective of having a mom and recovery. So Tom and Robyn, thank you guys so much for volunteering your time and going through the effort of putting together this presentation. I know we have a lot of people who are interested to hear what you have to say. And with that, I will turn it over for you to start your presentation. Thank you.
Robyn, you first, I think, right?
Sure. Tony did a great job of introducing our friend, my dear friend, Tom Jackson here. I first met Tom through, probably through the peer recovery specialist training curriculum and learning to be a 72-hour trainer. And Tom and I partnered together on organizing through Virginia Recovery Advocacy Project as well. The introductions were very thorough and wonderful, and that's there they are right there, exactly what Tony just said.
Yeah, I think the only thing I add to that is that I describe myself as a person in sustained recovery from substance use disorder and co-occurring mental health challenges, which is a particular focus. My last unprescribed substance was on May 13th, 1991. And that's how I like to introduce myself. So let's see, I'm going to talk about the agenda. Robyn's going to talk a little bit about VRAP. So we're going to do some introductions. We've got some disclaimers, since in particular, we're both government employees during the day. Why we're here, story from Robyn, a quote from me. What is a peer anyway? Because some people just don't really know. Talk about understanding peer support. And we're going to go pretty quickly through some definitions of wellness and recovery pathways. Then we will answer some sometimes problematic questions that are asked about the peer workforce, have a conclusion or two, and we want to make sure that we end up with plenty of time for questions and answers. And also, thanks to everybody. Thanks to Tony for hosting us. Thanks to Jennifer for arranging everything, and thanks to the Opioid Abatement Authority in general for being what I definitely call friends in recovery. So, Robyn.
A little bit about VRAP, or Virginia Recovery Advocacy Project. We talk in a lot of acronyms. I think a lot of us do. So if you hear us say VRAP, we're referencing the Recovery Advocacy Project, and specifically the Virginia component of the nationwide organization, Recovery Advocacy Project. We are a group of passionate grassroots organizers who meet to support equitable access for recovery support services and equitable access for peer services to allow for safe, non-discriminatory housing for folks in recovery, to offer life-saving, harm reduction, recovery support, training, education, and resources, and also to further the peer movement. We believe in the value of peer recovery support services. We believe in community-based, non-governmental organizations being part of this large network of primary providers. All of us are working toward the same goal, and Virginia Recovery Advocacy Project is a way of coming together to promote recovery and remove barriers to accessing recovery, treatment, and resources. Recovery Advocacy Project has a presence on social media as well as on our Action Network website. And if you are interested in joining us as an ally or as a person in recovery, we would absolutely welcome having you. And there's more information on that at the end of our presentation.
Yeah, there's a link to our Facebook page and so on at the end, although it's actually easy. Virginia Recovery Advocacy Project on Facebook. We actually made it simple. So disclaimers. So here's a few things, we kind of have to say, since again, we both work for several different government agencies. So everything we say is our own opinion, and we have lots of them. We don't represent our agencies. We don't speak for them. We really haven't used any agency resource for anything that relates to our opinions, although some of the fact-based stuff or things, for example, we do in groups that we teach. Robyn put this in, we assume no responsibility, yada, yada, for errors and so on. And we're certainly not benefiting financially from this. And then I put this at the end, please excuse my occasional language slips. I really try hard to keep it PG related, but sometimes I get really passionate about something and some of those words just kind of come slipping out. So I'm apologizing up front. Why we're here. You can take a moral judgment approach to addiction and people who still use drugs. PWUD is an acronym we use. Robyn said we use lots of acronyms, and we do. We'll try and translate as many of them as we can as we go along. But that's never solved the problem. In fact, these days, especially, it just leads to even faster and greater numbers of overdose and death. The running 12-month count of overdose deaths through a few months ago was about 111,000 across the country. And Virginia's are proportionately the same. So we're all here to save lives. So we do have to take a second and ask ourselves, do we want to solve the problem? And you all are here because you do. And that means using facts and people's life experience. And I call it this pesky thing called science. We've got a ton of evidence of the advantages of what peer support brings to building what we call recovery capital and saving lives. Recovery capital is a phrase you'll hear a lot. I see Allison Webb there, whose wonderful book, Recovery Allies, talks at length about that. But it just refers to the quantity and quality of resources available to individuals to initiate and sustain their recovery from problematic substance use. And for many of you as community leaders, you all have a great influence and impact on the quality and quantity of those resources. And Robyn's, one quick thing. We use the word stigma. We hear the word stigma a lot. I do a ton of recovery groups at Western State. And a few weeks ago, I asked 3 different groups, maybe 30 people total, can you define the word stigma? We hear it all the time. One person out of all of that could actually define it. And so Bill White, who is the historian of the modern recovery movement, really kind of breaks it down into 3 things, and I've stopped using it. We talk about shame, both inwardly directed and outwardly directed, but stigma is really just prejudice and discrimination. So let's just call it what it is, okay? Let's make it simple. Let's use words that everybody understands. Robyn's going to do some stuff on language at the end. You'll probably get sick and tired of hearing us talk about recovery language and so on. We'll try and not make it too overbearing. And now Robyn has a story to tell.
Thank you, Tom. When we first started thinking about coming here and discussing the evidence behind peer support, you know how Google kind of picks up on some of the things that we sometimes search online. It recommended that I purchase a t-shirt that had a slogan on it. I love my recovery shirts. And this t-shirt said, I am the evidence. So I wanted to tell you kind of a quick story about how I am the evidence behind peer support. When speaking on the value of peer recovery support in a variety of sectors across a continuum of care for opioid use, I can't help but reflect on my own story and the points where I might have wished that I had a peer or I could have benefited from this thing called a peer specialist. Just to have someone to offer their lived experience that mirrors mine, to demonstrate and model resilience, and to offer me this little thing called hope that I could get better. Those things would have made all the difference in so many situations. Those situations include going all the way back to high school when I was first prescribed opioids for a sports injury. Some guidance from someone who understands how powerful these things are. That would have been really helpful. When I was an undergrad student at Longwood College, now at Longwood University, go Lancers, after an accident, I was prescribed opioids again. And I discovered at that point that these little meds could make physical and emotional pain and trauma and all the things I was dealing with on a daily basis kind of fade away, especially when you add alcohol, which is pervasive in a college environment. Later on, when I was a graduate student at Longwood in the counseling program there, I was learning about this thing called the cost of caring and the burden of empathy in the helping profession. I'm sure a lot of you can relate with that as well. I discovered then that substances not only made me able to study and maybe kept me up, but they also made that burden of empathy a lot lighter. Working as a professional in the counseling field as a clinician, I was struggling to hold down jobs and trying to manage the heftiness of a chronic and debilitating autoimmune diagnosis in my early 30s. That would have been another key point where I could have utilized a person with similar lived experience to offer support and hope. When a few years later, I found myself in a very rocky relationship at home, I felt like I'd lost all of my power, except for the ability to escape with drugs and alcohol. To talk to someone, anyone who shared that experience would have been powerful for me. That situation led to me being involved in the justice system. starting with receiving a DUI in 2013 and then evolving into additional charges. The justice system is difficult to navigate, and just to have had a person to touch base with to help me figure out, hey, get there early and do this, or this is a way that you can advocate for yourself. That would have been very impactful. I became pregnant at age 38 unexpectedly after thinking I would never be a mother. And at that point, I decided to stop using all of these things and stop escaping from pain. But just stopping using substances is not exactly recovery. And we'll talk a little bit more about that in a few slides. But to have had someone who understood what I was doing with my body, what the things I was feeling with withdrawals, the emotional responses I was having to a pregnancy, to have a peer who was knowledgeable in that would have been very impactful. I am a military spouse, and my husband's career took us out of state 3 weeks after we got married. And I didn't know anyone, and that just furthered my isolation. After having my baby, pictured here, Sawyer, who turns 8 next month, having him was a really confusing time. He came 9.5 weeks early, and I had to have an emergency C-section, and I had stopped using opioids, but was sent home with a very big bottle of Dilaudid and not a whole lot of guidance on how to manage this stage of my life. In April of 2017, I returned home from where we were living in Mississippi and tried to resume use on the same schedule and pattern that I had before we left Virginia. That resulted in me being on the receiving end of Narcan administered by some of the same EMTs and paramedics that I had volunteered with in my small hometown 25 years before. And finally, when I tried different pathways and nothing seemed to work, I took myself up 2 really big flights of steps to a buprenorphine clinic and got induced on Suboxone on November 29th, 2017. I could have benefited from having a peer to help me set up that routine then too. So that's 11 different points along my life path where I would have welcomed a person to break my isolation and see me and validate me and listen and help me make a plan to recover. 11 opportunities for my story to have been different or to have prevented the next traumatic event. To know that I wasn't alone would have made all the difference. But this story isn't a sad one. It doesn't end with me looking in the rear view and wishing things had been different. At a few key points further down my map, I did discover the value of peer recovery specialists. And I saw how one small bridge of understanding could lead me to a better future. I found the evidence for peer support, and I found it within my faith community, people who were living their recovery out loud within my church and encouraging me to grow alongside of them. I found a PRS trainer, Marjorie Yates, who believes in me to this day, and sees my passion through a lens of potential and possibility, not just regret and mistakes. I found program managers and peers at the Sarah Center for Recovery and Alive RVA, which is where I obtained my 500 hours of peer supervision to become certified. Folks there showed me the value of community and advocacy, especially during a global pandemic, and offered me the connection that's vital to starting a career as peer specialist. I've found multiple treatment professionals, case managers, clinicians, folks who have become true allies, who have showed me that peers are indeed spokes in a wheel and that we work together toward that common goal, and it doesn't have to be an either or. I found allies at Goochland Powhatan Community Services who took a chance on me as their recovery coordinator almost 3 years ago, and they saw me as more than a criminal record or a risk. I have peers in a rich rural area where I'm able to serve, particularly within my first responder community, where we were able to build the rural overdose team. That is really just, it's a magical experience to be able to serve in that capacity alongside of our community's heroes. I found other peers through Recovery Leadership Academy, which is a project through VCU and DBHDS Office of Recovery Services, where I learned to hone my skills as a peer leader. Virginia Recovery Advocacy Project helped me find my voice as a peer. DBHDS, the Office of Recovery Services, trained me how to train others to be a peer recovery specialist. Last summer, I was facing a pretty scary diagnosis of possibly having a questionable lump related to breast cancer. And the peer community, my recovery support system, rallied around me, and I was able to get through a surgery and not miss a beat with my recovery. And finally, I'm able to celebrate Year of the Peer, which is 2023 all year long, and continue demonstrating how we build these bridges of understanding between community partners and people in long-term recovery. That list goes on, but hopefully you're seeing the point that the 11 instances where I could have used a peer are far outweighed by how peer recovery specialists have shown up in my life. If all these opportunities for recovery are present in just my story alone, just imagine the impact that could be made by the now over 1,000 certified peer staff in the Virginia recovery workforce. So we're beginning today the way that many tellings of stories end in recovery settings, with me saying, thank you for allowing me to share a little bit of my lived experience with you this morning. I do feel that peers are the evidence behind peer support. And thank you to the Abatement Authority for having us here and for believing in the value of peer specialists and allowing us to share more of that evidence basis as part of the Abatement Academy. Hoping this session will inspire you to seek out opportunities and ask questions about how certified peers can support that common goal of stopping the opioid crisis. Thank you all for letting me share. Tom?
Thanks, Robyn. Thanks so much for sharing your story and so many points where peer services would have made a difference. I haven't sat down and counted, but I'm sure I'd probably hit at least 11, maybe more, but just because I just have a few more years on my odometer, as a friend says. So I want to talk about two things real briefly. My motivation for doing this. I saw this great quote. Tom Insel, who's the former director of the National Institute of Mental Health, in his book Healing that came out about, I think, 6 or 8 months ago, quoted a parent of a child, young adult with mental health challenges in particular, said, our house is on fire and you're talking about the chemistry of the paint, about the $10 billion that they have spent on brain research. And actually, we have some interesting indicators of stuff, but turning that into actual practice is actually something where peer support comes in, because there's more evidence in some cases for that than some of the brain research that's been done. But anyway, the parents said, what are you going to do to put out the fire? And this took place at a recovery community organization. We call them RCOs. There's another acronym. And the director of the center then told Tom about the 3 Ps, people, place, and purpose. And we'll see how that resonates in a couple of minutes when we talk about definition of recovery and wellness and so on. So I have a secret to tell. I'm a dealer. And these days I deal in hope. I deal in promise. And we were putting together a description of a panel at Mobilize Recovery, which is our national convening in DC in September. And I talked about all these great words about collaboration and so on. And then I ended it with saying, and then I throw the occasional stone when I need to. But what advocacy has done for me is given me a voice for myself and others. That picture was taken on the front plaza at the Department of Health and Human Services last September, when Mobilize was not in a fixed place, but was a 10,000-mile bus tour across the country. And just before that picture, in a forum with Miriam Delphin-Rittman, who's the Assistant Secretary of HHS and the Director of SAMHSA, I stood up and asked a question because she was talking about the value of recovery services and recovery support and community organizations and all of that. And they had these 4 beautiful slides on 4 different dimensions of something. SAMHSA thinks in dimensions. You'll hear it over and over until you're sick of it. And I stood up and I said, you're missing the next dimension on that, which is time, because you don't have the urgency. And for those of you that provide services, you certainly know this. And I asked the crowd, I said, when somebody says, I want help, I'm ready for recovery, what's that? We call it a window of opportunity. What's that window of opportunity? And, people yell out an hour, 10 minutes, maybe a day, and so on. And I said, you don't have that up on your presentation. And I got a room full of applause. And if you had told me that 2, 3, 4, 5 years ago, I would ever stand up in a room and ask an assistant secretary of anything a challenging question, I probably would have either laughed or cringed. I do want to actually make one comment. You'll hear SAMHSA over and over. I've heard people say, who is SAMHSA? SAMHSA is the Substance Abuse Mental Health Services Administration. Part of HHS, does tons of research and provides lots of really practical guides to things. And we'll show one. In a minute. So what is a peer anyway? And in this particular context, we're talking about some pretty specific definition, in that we're really talking about Virginia certified peer recovery specialists. As Robyn said, I think there's about 1,400 I heard on a call yesterday or the day before. People who combine rigorous training, a supervised internship, ongoing education, professional supervision, life experience, and certification by an independent body. I have a pet peeve when we are introduced solely as people with lived experience, which among other things, I try and change to life experience, because lived experience was yesterday, life experience is today. But we also go through all this other stuff, and Robyn's going to talk in a sec about some of those. There are people in recovery spaces who use other life experience and titles, people, recovery allies, recovery coaches, and so on, who are trained and in some cases certified. But for this talk, we're just talking about Virginia certified peer specialists. So in the next slide, I'm going to actually throw out some statistics about what a great job Virginia is doing in terms of the rigorous training and certification that we go through. And Robyn's going to talk for just a sec about the Year of the Peer, which she mentioned earlier.
Yes, Virginia Year of the Peer. Hopefully some of you have heard that this is Virginia Year of the Peer 2023. So what does that mean? There have been 2 conferences actually already where peer recovery specialists from around Virginia have come together to build those bridges of understanding. That's actually verbiage from the mission statement, which was written by a collective of peers who have given feedback about the entire initiative. Everything from the mission statement, vision statement, core values, that logo and the symbolism of the different parts of that logo, all of those things were crafted and curated by members of the peer recovery workforce in Virginia. So we're super proud of that initiative, and there are going to be more local and regional events. There is a website, there are videos about a little more about peer support and the unique role that we play in just building those bridges of understanding and who we're seeking to build those bridges with, which is community partners, clinical partners, and each other as we support things like multiple pathways and peer inclusion. I think that about summed it up, Tom.
Thanks, Robyn. And also, Year of the Peer gave out quite a number of micro grants, and VRAP was the recipient of $2,000 that we spent on providing a 4-hour training in what we call narrative disruption, which is a way of telling our stories in a very personal, motivational way, sort of the elevator pitch version of a recovery story, really trying to engage and hook people in as little as 60 to 90 seconds if we meet you somewhere. If you sign up for our mailing list, and again, the links are at the end, we are going to be doing a part 2 sometime later in the summer, and keep an eye out for that. Joseph Green, who's one of our folks, who is a spoken word artist, lives in Springfield, came down to the McShin Foundation to do that. We will be, of course, actually Jennifer will be, not we, Jennifer will be posting our slides and the video and everything, and Robyn did a beautiful job. All of these underlined things in these slides are links, and they go to the varying places where that information is available. So, okay, I already said who is SAMHSA anyway. Virginia was a little late to the game in terms of certifying peers. It was really 2015, 16, 17 that took place. Places like New York, Pennsylvania, Rhode Island, a number of other states had been certifying peers for at least 10 years before that. But when Virginia came and did it, we did a really great job. SAMHSA just released national model standards for peer support. They went out and they surveyed 49 states and got a staggeringly wide range of numbers for all of these things. And a bunch of people got together and came up with sort of recommended model standards. So just in terms of training, Virginia's training that Robyn and I are both trainers of is 72 hours compared to a recommended 40 to 60 hours. Supervised practice, where after we've done the training, we actually go out and do the work. Supervise an hour supervision for every 25 hours of practice compared to a recommended national standard of over 120 hours. A certification examination done by the Virginia Certification Board. The exam is hard, quite frankly. It's a pain in the ass. It is not a simple exam. Fortunately, the Office of Recovery subsidizes the fee for it, and also, if I remember right, that includes retakes, which some people need to do. Prerequisite education, high school diploma, GED in Virginia, nationally just literacy and fluency in the language that they're providing services. Background checks for certification, it's a self-report with some waivable crimes. Nationally, it's just part of employment. For employment and barrier crimes to employment in Virginia is a huge topic that we could spend at least an hour on, maybe 2. And all I'll say is that we have the highest list of barrier crimes in the country, 176, which is over 100 more than the next state that details them. And there is a big movement going on this year through the legislative session in January to seriously change that. We think we have real hope for the first time in 10 years of making some progress on that. So again, sign up for us and for our information, and we'll keep you posted. Ethics, which of course are critical. There's no national requirement for ethics training. And Virginia, we have to do 6 hours of ethics training every 2 years. And this one's me too, right? Mm-hmm. And I'm going to skim through, right? Isn't it? My note says?
That sounds right.
Okay. And then I'm getting tired of talking. So if you want to do the next few after this, that'd be wonderful. I get really tired of hearing my own voice after a little while. We talk about recovery, resiliency, wellness support domains. So what do peers do? We develop relationships. We establish communities. We work, especially in vocational environment, whether it's a job, whether it's volunteer work, finding a vocation, finding an avocation, something that we love doing to enhance our lives. Providing access to resources, and in some cases, creating those resources. Providing access to and providing education. Most people that I've known in 32 years of recovery, one of the first things they do is go back to school. Actually, one of the first things they do is go to the dentist. But usually the second thing after that is looking into schoolwork and housing. Of course, the OAA has done some wonderful grants so far in terms of supporting recovery housing, and we just need a staggering amount more. And Robyn, I'm going to turn this over to you.
I will take this one. So This is just a short list of some of the characteristics of peer recovery specialists. A lot of the characteristics of what makes a good peer specialist are the same as reasons why your organization might consider integrating them if you aren't already. Peer recovery specialists are self-aware and connected, and that's a big piece. We don't just wake up one day and say, I'm in recovery and now I'm ready to share my story and I know who I am. I didn't know who I was as far as being able to say, my name is Robyn, I'm a person sustaining recovery, and that looks like this, probably 2, almost 3 years after taking that trip up the steps at the clinic. So that authenticity piece comes with time, which is one of the reasons why I think the Virginia Certification Board requests that if a person wants to take the 72-hour training, that we manage to hold down a year of recovery. It can be hard to measure recovery, especially if you are maybe in and out or back and forth between pathways. But as a general guidance, it takes about a year to get some traction in this new way of living. So peer specialists have that authenticity and self-awareness. We also have open-mindedness, and we'll talk more about multiple pathways about a little after halfway through. We are flexible, we're adaptable. These are, again, things that come from connecting with others in recovery and also being able to share our lived experience and receive and hear and validate the lived experience of others. We are empathetic, we're responsible. And here's the funny thing too, like Tom was saying about if you'd ever thought he spoke in front of a secretary of anything, I would never have used these words to describe me when I was sick, when I was looking for something, a way to live my life differently. But these are characteristics that I think embody every single person who is working in a peer role in the recovery workforce. And these are assets to any organization or community. Can you take next slides, Tom?
Okay, this one, it's not the content really, it's the number that this has been a working list that I've used in training classes, and Robyn and I went over it and identified 32 different places that peers are used in the workforce. Some a very little bit, just starting. Some have been there forever. We're not going to go through the list at all. But the important thing is to think of that so far, you know, we've identified 32 different places that peers work in the workforce. So, you know, it's not just in community organizations, it's not just at CSBs. And then Robyn is going to talk about our hope for the future.
Yes, so that's 32 awesome opportunities where we know peers are placed, where we know peers are making a difference. Where are some areas of opportunity? Where are some programs that we might be able to see peer support having an impact? And we drew a lot of these from my story. Post-surgical recovery, things like cancer centers. Anytime anyone's prescribed an opioid, quite frankly, if they could talk to someone who knows how that story could play out. Pharmacies, as a person on medication-assisted recovery, and I have been for over 5 years, closer to 6, I can tell you that every 28 days, actually, my husband could probably tell this story a little bit better. Every 28 days, I have to take 6 hours off from work to go to the clinic, go to the pharmacy, find out that they don't have the right dosage in stock or this or that. We have to do certain things to make sure that we get our medication on time, because that's part of the structure and routine that keeps me in recovery. And pharmacists and pharmacy techs could use some education on medication-assisted recovery, things like harm reduction, sometimes maybe even some reminders about, hey, this is a life or death thing. And if that person's a little bit frustrated, it's probably because they've been to the 6th pharmacy today. So I could see a path for peer support in pharmacies and that type of environment. Holistic wellness clinics. I just had the honor of, in March, taking the training to become an AccuWellness specialist, which is 5-point auricular ear detoxification using acupuncture. And it is some powerful stuff. So that's another skill set that peers can assume, as along with things like yoga and breath work and flotation spa, which is part of my personal pathway, just about learning to practice mindfulness and get centered. OBGYN offices, lactation consultants, military family peer support, of course, drawn from my own experience. Schools, there are youth support partners and family support partners who can assist not just the student, but also the parents and the whole family to embrace recovery. Financial wellness, physical wellness, which we'll talk about the 8 dimensions here shortly. And this is a really great place to kind of talk about the continuum of care as we know it. I found a great article that refers to the continuum of care as a cascade of care. And I like that imagery because we pick up all these tools along the way. And when we share them, they go cascading out into the community. But the cascade of care was a new way of looking at the continuum in 4 ways: recovery priming, which is outreach; recovery initiation, deciding our path or trying a new path; recovery maintenance, or medical model would call that remission, when our disease has maybe backed off a little bit and we're working on doing life. And finally, recovering citizenship, which is so vital. And I think peers can be used across all 4 of these elements of the cascade of care, but especially in things like recovering citizenship, because peer support's all about community. So those are just some ways that we have integrated into the current continuum of care, and how we might be able to continue furthering that cascade of care as we fit into some non-traditional roles. Next slide.
Okay. And this one's you too.
Oh, of course. So some of the services that we provide in some of those roles, and again, it's not so much about each individual line, and I'm seeing some awesome suggestions in the chat. And there are some programs that are doing those things or developing those things. So what kind of skills would we bring to some of those roles, whether they're hypothetical or already in place? Role modeling, crisis support. This is describing that cascade of care. And cascade of care implies that it's not like, well, you do an assessment here and then you go to this phase, and then like everything's not so neatly compartmentalized. There's room for the overlap. And I think that's the most important part of the services we provide, is the overlap across the domains and those transitions between different levels of care. When someone completes IOP, it's not like you're at the finish line of recovery and you just resume doing whatever you were doing before. We support during transitions as well as during clearly defined levels of care. Next slide, please.
Okay. I just want to make one comment on just a couple of things in the comments. A lot of the things that people are listing are in that long laundry list of slides. And anywhere, like Robyn said, between fully implemented to just taking baby steps. Emergency departments are a big one. Department of Health Professions a year and a half ago put out a phenomenal document put together with BCU and Curlian and Roanoke on best practices for, in particular, overdose treatment in emergency departments. A couple of people proposed putting that into law a year and a half ago. And even though the Virginia Hospital Association and the emergency room docs were behind it, the General Assembly shot it down. So to make it mandatory in emergency departments. So we're going to be bringing that back. Let's see. This is the underlying title of what we're doing is about evidence. And totally coincidentally, it made our life a lot easier in terms of doing research. SAMHSA came out with what they call TIP, treatment improvement protocols, It's about this thick. It's 300 and some odd pages long with almost 800 footnotes. And I just cited 5 of them in this of the evidence base of peer support. And if you want details and footnotes and all those things, please download the document. You can just Google SAMHSA Tip 64. But we know peer support reduces recurrence, increases motivation, increases engagement, increases retention, and improves relationships. Robyn's going to talk a little bit about concepts of wellness and recovery. We are running 14 minutes left, right? And we want to leave some time for Q&A. So I think we're going to go through this really quickly.
Mm-hmm. We can go ahead to the next slide. This was a transition slide just to show us some of the concepts surrounding peer support and things that matter. And when we're defining wellness, I think it is yours, but I can ask you the question, what's the difference between wellness and recovery? They often do get tossed around interchangeably.
Yeah, so the simplest way I learned to describe it is that wellness is the destination, recovery is the journey. Of course, it's a lifetime journey. My definition of wellness today will be different from it tomorrow. We'll talk about the dimensions of wellness in a minute. And then this is, I stole a quote from somebody yesterday or the day before, and I didn't jot their name down to give them credit, but somebody said, when does recovery start? At the intersection of readiness and opportunity. And for those of you that are writing grants, asking the OAA for money and so on, you grantees can provide many of those opportunities. And this one,
I think that's going to be me, because anytime I see multiple recovery pathways, my antenna go up and I get a little bit more pep in my step. So those of you that have heard my story, you know that I am a believer in multiple recovery pathways. We often associate multiple recovery or multiple pathways with use of medication-assisted recovery, things like Suboxone, buprenorphine, and abuse, the alcohol use disorder medications as well. But multiple pathways can include just about anything. People use 2 or more pathways on their road. I haven't found a whole lot of people that only use one pathway. And oftentimes it is trial and error. And I mentioned that in my story. I thought recovery had to look a certain way. Everything I knew about recovery up until about 2 years into my recovery journey, when I realized that I was in recovery and I have a voice and I can talk about these things, everything I had heard was, well, you go to 12-step meetings and I think they smoke there and there might be coffee. And I didn't know anything else about multiple pathways. But we do an exercise when I do the 72-hour training where I have people write down the things that help make them well. When we talk about wellness and recovery, what are the things that keep you well or make you well? Whether it's medication, Narcotics Anonymous, Medication-Assisted Recovery Anonymous, whether it's church, family, yoga, running. It's not running for me, but it might be running for someone else. So all of these things actually end up being part of your pathway. And you can combine traditional and non-traditional services and supports. And sometimes my pathway looks very different. Someday I may not be on medication, but I might do something different. So multiple pathways, no 2 stories look the same. And it's a peer way of really getting to know themselves and what propels them toward wellness so that they can share that with others. Next slide.
Okie doke. So I'm not going to read through this at all, but hope is the foundation of everything we do. It is really what peer support started being, that I can sit down with somebody at the hospital and my caseload at any given time is probably 10 or 12 people, some of whom are searching for answers, some of whom are stuck, and some of whom know exactly what they want to do. But I describe myself as the hope broker. And so when I say I'm a dealer, I deal in hope. The other foundation it has to be person-centered. Sampson's definition of recovery we'll get to in a sec. Living a self-directed life and empowerment. There is a phrase in the peer movement that goes all the way back, actually, I believe, to the late 60s, early 70s, nothing about us without us. In the advocacy movement, we say, if you're not at the table, you're on the menu. Mm-hmm. And this one, actually, this was mine too. Isn't it?
I think so.
Nope, this is yours.
Oh, okay. Definition of recovery.
Yeah.
I can take definition of recovery. So there is a definition of recovery as indicated by SAMHSA. It's hard to define recovery because what works for me may not work for Tom. It may not work for everyone else. And if we're emphasizing voice and choice, and we are emphasizing what's strong, not wrong, what's strong in me may not be what's strong in someone else. So this definition of recovery is a great starting point. At Goochland Powhatan Community Services, actually it's this afternoon, we have a hybrid meeting because we have to be able to reach people and have things be accessible called Recovery 101, where we talk about this definition of recovery every week as a starting point. And then we lay out a menu of recovery options, talking about multiple pathways. And those who attend this meeting get support in figuring out what their definition of recovery is and figuring out what their pathway is. But there's a few key phrases in here: process of change, individuals improve health and wellness, live a self-directed life, and strive to reach full potential. Doesn't say anything about specific drugs, alcohol, mental health. It's just a nice all-encompassing definition. And then there's 4 dimensions that Tom was touching on a little bit: health, home, purpose, and community. Those 4 things make up recovery. So if we can check off those things and get people to their fullest potential in each of those dimensions, then they are in recovery. In my pathway, a lot of people use the phrase, you're in recovery when you say you are. And I really like that because there's empowerment with that. And in a world where a lot of us feel like we don't have any power, or we've lost a lot of the power we used to have, having the power to say, I am a person in recovery, it makes a difference. And we can slide to next slide.
Yeah, okay. I think this one's me, right?
I think so.
I'm gonna, oh no, this one's you. This one's you.
Oh,
We've
is it?
got about 3 minutes left.
Mm-hmm.
We got about 3 minutes left if we're gonna take some questions. So. You want to do this one?
Oh, I thought we were skipping it. I'm sorry. If you could, could you skip to the language slide? That would be great. We'll get that one.
Let me stop real quick at 8 dimensions of wellness. This is the other part of SAMHSA, the definition of wellness. We talk about 8 dimensions, and I do a lot of work with people turning this into a checklist where how am I today on those 8 things? And what do I need to work on today? And anybody can use this as a checklist. You don't have to be in recovery. Anybody can use this as a checklist. Where am I on these things today? And language.
Yes, a few tools here that are also embedded links, but language matters. And I've learned a lot of this through working in the advocacy arenas and just figuring out how we talk about ourselves as people in recovery. It sets the tone for how others communicate with us. I see some of my folks from Goochland Powhatan here who know that I have this recovery dialects flyer posted up outside of my door. And it's just a helpful guide. It's a helpful reminder to me that in certain places, I do decide how I refer to myself, but sometimes there are words that belong to the person in recovery. So these helpful tips include the Shatterproof Language Guide, which is a really awesome book put together by Shatterproof, which is a nonprofit advocacy organization in New York State. Recovery Research Institute's A Dictionary, which is really, really helpful, especially in clinical settings, and a visual aid like Recovery Dialects. I've seen a couple variations of this one as well.
One real quick comment. This originally came from work from Faces and Voices of Recovery that many years ago did a survey that said when people describe themselves as a recovering addict or a recovering alcoholic, something like 80% of the people surveyed thought that meant they were still using substances, which is why in public, and actually I don't even do it in recovery spaces anymore, I never refer to myself as even a recovering addict or alcoholic. I just refer to myself as a person in recovery because that's who I am today. I haven't been an addict or an alcoholic for 32 years. One quick thing we wanted to talk about, there is prejudice, discrimination, shame, stigma, and so on about peers in the workplace. And that, of course, is ultimately what the goal of peer certification is for peers to be employed. How do we tell if people are stable? What happens if there's a return to use? What's the training certification? What are promotion paths? That's a big thing the Office of Recovery is working on, is to actually come up with a higher level of certification for those of us that have been doing this for a long time. How do we integrate into a team of trained clinicians? I work on teams at the hospital with a psychiatrist, a psychologist, a social worker, a mental health worker, and rehabilitation folks. And how do we fit into that? Again, what is recovery? How much do I have to pay people? Well, a living wage is a start. Fortunately, last year we got Medicaid rates raised to the point where you can now pay a peer specialist a living wage and not lose money on doing it. 2 minutes for questions. And thank you, by the way.
Thank you.
Thank you, Robyn and Tom, for sharing your stories and your continued recovery and the important role that certified peer recovery specialists can play. I'm glad that Tony and the Opioid Abatement Authority brought you into this Abatement Academy. And if there are any questions, please put them in the chat. I do have this one from Lisa. It says, I am with a reentry council. 75% of our returning individuals who participate in our program have a substance abuse issue. I strongly believe that peer support specialists could be a great help like a sponsor would be in AA or NA. But how can I ensure that these peer support specialist individuals have training and supervision?
That's a great question. I'm going to try to scroll back up so I can address the parts of that. I also believe that peer support specialists are a great help in there. There was a statistic that I found in doing the research behind the evidence that says 50% of people who are leaving a treatment center or leaving a treatment program in recovery have a recurrence of use within 90 days. That alone is the evidence, I think, for using peers as the mortar when you have these bricks of treatment, these awesome, solid, wonderful treatment programs. But then we get out of incarceration, we get out of treatment, we graduate from IOP and we go back to the real world and we don't have that structure. So peer support during those transitions, we support during times of change. How do you ensure that peer support specialists have training and supervision? That's another awesome question. We advocate that you don't usually, if you can help it, have just one peer specialist working in an organization. The crux of peer support is that we support alongside of others. So having multiple peers, even if they're part-time, is a wonderful opportunity to start building the base of peer support. There is a supervisor, like how to supervise peer recovery specialists training that can be, you can receive passwords for it. It's a self-study, self-paced training offered by Office of Recovery Services. And we highly encourage supervisors, whether they're clinical or peer supervisors, to take that, just because supervising and onboarding a peer can be a little bit different, and you want to be aware of how their recovery plays into their role. It's really hard because I say a lot, working in the recovery field is not the same as working on my personal recovery, but we have to give both plenty of airtime and make both a priority when you're employing a peer.
Very good.
And just one very quick thing, if that's okay, on transitions from jails and prisons. There's a law that takes effect next July. It got kicked down the road a year, unfortunately, on beginning drafting policies and procedures and best practices for people coming out of jails and prisons to the community. People who are coming out of jails and prisons have a 471 time greater risk of overdose in the first 3 days than people on the street. Not 471%, 471 times. So that's how critical that transition is.
Well,
okay.
Well, those are the only question. That's the only question that we had. I want to thank Tony McDowell, Executive Director of the Opioid Abatement Authority, for putting the Abatement Academy together and bringing in Tom and Robyn to share these programs. Look for an email from me soon that will send out resources and a link to this video so you can watch it again and pause and look at the slides real close up. And remember that the Abatement Academy series continues every second and fourth Thursday through 2023. Tony, do you have anything else you want to add?
Thanks, Jennifer. Just a real quick thank you to our presenters today. A very informative presentation, and for all of those in attendance, just want to direct your attention that the next 3 sessions that we do, the next 3 webinars, are going to focus on investing in youth prevention. So on August 10th, we'll be hearing from Horizon Behavioral Health about a variety of evidence-based approaches that they've been using successfully. August 24th, we'll hear from Fairfax County Community Services Board regarding youth and adolescents substance use prevention strategies across Northern Virginia. And then a very exciting presentation, September 14th, about the Recovery Academy in the Chesterfield County area, the high school experience that's changing lives. So please look for those opportunities on our website, and we hope to see you on those webinars as well. Thanks again.